Well, I think in aesthetic medicine, the biggest change is the whole approach to faces is more global. In other words, instead of just addressing a zone or a line or a crease, it's more addressing the whole face. And if you can realize that the global approach to fillers is now the norm. It used to be the exception, that we looked at reflating eyebrows and cheeks and earlobes and noses and jaw angles and doing all these things we do now was the exception. It's the normal approach to creating awesome results.
I really think this is one of the most exciting times to be an aesthetic physician because we finally get it. We understand that we're not about chasing lines and wrinkles. We're not trying to change how people look.
We really want them to look natural, and that's the hard part. We're not just filling lines anymore. We're using this approach to reflate other areas and not just the nasolabial fold and oral commissure.
We've really focused on small areas and partial rejuvenation, but it's really about rejuvenating the whole face and correcting total volume loss for the best results.
If you stick to just a few lines or a few little like the folds and so forth, and don't look at the whole face globally, then it's like an unfinished piece of art.
And so when you treat the whole face as an aesthetic unit and you look in a global way, oftentimes what you do is you rebalance and you create harmony and you help make people the best versions of themselves.
The reflation technique really focuses on the entire face and realizing that there's volume lost almost every place, and it really gives you a much more complete and natural result.
The traditional technique and the technique that I've been using for a number of years is quite the opposite. The retrograde in fanning, ferning, cross-hatching, linear threading, all that does is inject into the dermis or the sub-Q and doesn't create lift. So its injection technique of antegrade means that you inject in the deeper tissue, lift a bit where the area is sunk, and as you inject anterior grade, it lifts the area that's sunk, so the filling creates lift.
Reflation has completely changed the way that I practice aesthetics. Working with Dr. Remington not only gave me a different perspective on restoration of the face, but also a new approach to volume.
For me, doing reflation has actually turned my practice around 180 degrees. Whereas before I would do a consultation with patients and talk to them in terms of numbers of syringes, now I talk to them in terms of areas that we're going to change. And that makes a big difference.
Patients have actually called back ecstatic, telling me how amazing this is. They've had treatments for so long by a variety of different doctors and have never really seen this kind of change and improvement, yet it looks so natural for them.
When you do a reflation technique, it's so many magnitudes better in terms of how much better the patient looks that it really is worth it to people.
But you'd be surprised by expanding yourself from doing 1 or 2 syringes to even as much as going 3 or 4 syringes will make such a difference in the way you can add and reflate these patients.
And I find now that I go further. I use more syringes, and the patients really appreciate that because they get a much more complete result, and that's what makes patients happy.
It's improving my bottom line, and it hasn't affected my patient flow. It's actually improved it, and I'm actually getting more patients now than I did before.
We're not chasing lines or wrinkles. We're helping rebalance the face, rejuvenate, and reflate.
So you have an interest in making your patients look great. If your focus is making a lot of money, you'll probably never make patients look great. But if your focus is creating great results, you'll probably make a lot of money.
Many physicians are not aware that this really is the premier type of rejuvenation. And when people understand it and experience it, they're locked into your practice forever.